Hey guys, how y'all doing today? This is D Durrell with D Durrell Life Solutions. I hope you all are having a great day today. So today's topic, let's get right to the point, and we're going to talk about goals of therapy. We're going to talk about being realistic for therapy and what one wants to achieve in therapy. Now, my inventory of clients that I have encountered over the years, particularly in the infancy stages of the therapeutic process, we talk about what led them to want therapy in the first place. I may undergo what's called a questionnaire, even a psychosocial assessment, which basically gives a background of that client over time. I may throw in a few other assessments that may in somewhat analyze their anxiety, depression, social skills, behavioral skills, depending on the age. And so in many instances, particularly when we're talking about adults, and I'm talking about people, not even adults, I'm going to say basically pretty much adolescents from the ages of maybe 12, 13 on up, we engage in a brief discussion about what led you to therapy. Now, particularly when we're talking about adults, they simply will easily kind of specify specific events that have occurred, which are usually negative, or that are stressful, that have contributed to their need for therapy at this point. When it comes to adolescents, particularly those between 13 years or up, there seems to usually be a situation where they don't feel that they're the problem. Maybe there's other circumstances that other people are at fault, and they're reactionary to that, or someone is making them do that. Because particularly when you're looking at those ages, therapy is usually not something that a adolescent wants to do, or that's something that they see as necessary. It's usually an adult that is making it involuntary for them most of the time, not all the time. Just want to say this, most of the time, not all the time, depending on the situations. So when we're talking about therapy, we want to talk about what were the issues that led there. Was it poor relationships, trauma, socialization issues, stressors as it relates to school, work, family, dating, finances, all of the above? So, in that, first we want to understand that there are limitations to therapy. There are limitations to the fact that this is not a cure. Therapy is not an intervention in which it's a one-shot thing in which 1 or 2 sessions or whatever amount of sessions are supposed to change your life overnight. It is a growing process. It is a developmental process. It is a practical process over time. Some type of issues require what's called brief therapy, which solution focus orientated type therapy, in which a person has adjustment related issues that may require 3 to 5 sessions. And then there's things that may be more long term, where they may need therapy for several months or 6 years, and then for the more severe it could be over a year or so, depending on the situations or the multitude of various situations that have accumulated over time, that have compiled over time and continue to cause some level of mental health discomfort. So as a therapist, it is my duty to assess that and to intervene with the client in an effort to get them to give me as much information as possible so that I can structure therapy in a manner that will be conducive to behavioral change and long-term growth and long-term psychological benefits in the positive. So with that being said, therapy is meant to be a tool that can help people improve over time. Therapy is a intervention that allows you to learn things that you may have not learned about yourself, and to assess things, to show more insight, to recognize things. There's a lot of teaching going on. There's a lot, particularly depending on what type of model you're using. There's a lot of, reflection going on, per se. A lot of insight that's being shown. There's a lot of, I would say, therapeutic discovery that is going on between you and your your therapist, who is the helper or the facilitator that allows you to recognize these things. So typically, in most situations, when we're talking about goals and we want to be realistic, we want to set a treatment plan, a form of treatment that is somewhat 90 days, 60 to 90 days, 60 to 90 day increments. Most of the time for myself, treatment plans basically last about every 90 days per se. You want to create a treatment plan, reassess that treatment plan every 3 to 6 months, depending on the client, depending on the situation, particularly for children, every 3 months, without a doubt. And also, if there's a lot of fluctuation in a person's behavior, particularly if they have indulged in behaviors that are putting their life at risk or someone else's life, incarcerations, homelessness, things of that sort, some type of medical issue that's contributing to mental health, then we can also assess those things on a monthly basis or every 30 days. So, some clients, potential clients, do come into therapy with an unrealistic expectation. Then there's those that they don't have any expectation, and those that have realistic goals that they come up with. In most of those situations, those goals can be somewhat restructured. Some of those goals may identify other goals. And typically we want to work on about 2 to 3 things at a time. Some people can have a host of things of 5 or more, and we may kind of, merge some of those things together. And we work on one thing at a time. One thing at a time, one day at a time. You have to do the therapeutic work. You have to put the effort. You have to be consistent with therapy. And you have to be, in order to get the full benefits, be open and comfortable with talking about things that make you uncomfortable at times with your therapist. So my goal is to make sure those goals are somewhat measurable. Those goals are going to be identified. Those are goals that are definitely beneficial to that person's life, and we help that particular client obtain those goals one goal at a time. One goal at a time, and it takes practice, it takes consistency, and that's how therapy is, in my position, in my clinical professional position, is more beneficial to anybody, including myself. So again, guys, this is D. Durrell Spears with D. Durrell Life Solutions. Have a great day.